Namaste, my name is Sriman Sharma. Welcome to Hot International Video Podcast. Today, we'll talk to Dr. Rebecca King, Principal Investigator of Community Solutions to Anti-microbial Resistance COSTAR project. Dr. Rebecca is also the head of NOFIL, the Center for International Health and Development, based on the University of Leeds in the UK. We'll talk about COSTAR project, which Hot International has been implementing in Nepal. COSTAR is a consortium project that seeks to address the drivers of antimicrobial resistance, which has become a global public health threat today. Welcome, Dr. Rebecca.
Thank you.
Would you please share a brief background of COSTAR project, how the concept of this project emerged?
COSTAR stands for Community Solutions to Antimicrobial Resistance. And the background for this project was an observation that there's lots of international guidance on what we should do to tackle the drivers of antimicrobial resistance. And within that guidance, there's lots of emphasis on raising public awareness about antimicrobial resistance. However, public awareness suggests that you're looking at an issue from a very top-down approach, so you're trying to increase people's awareness, raise their knowledge about a topic. And there's another way to look at public relationships with AMR, and that is to think about engaging people in creating community-led solutions that are feasible and acceptable to them within the context that they live in. So we were involved in a project actually in Bangladesh where we took an approach to community engagement called the community dialogue approach, and we have adapted it to the health system and community context of Bangladesh, and then we have also looked at the AMR context that we were working with. So we piloted that project. But at the same time, we were also working in Nepal using a different community engagement approach to addressing AMR, which is called participatory video. And participatory video works on the basis that you train people within communities to create short films about antimicrobial use and the drivers of antimicrobial resistance within their setting. And then they use those films to raise awareness and to think through community-based solutions to addressing AMR. So COSTAR emerged out of these two projects, and it emerged out of a sense that rather than focusing on a top-down approach to addressing AMR through public awareness building, rather we should be looking at a bottom-up approach to AMR, whereby we liaise and we create equitable partnerships with different stakeholders within community settings to think about appropriate and feasible solutions to the critical problem of antimicrobial resistance.
So, what is the aim of this project? Would you please tell us the major objectives of this project?
The overall aim of COSTAR is to create innovative community engagement approaches to addressing antimicrobial resistance. And within that, there are some specific objectives. So one of which is to create a set of intervention materials that we can use to address the drivers of antimicrobial resistance. And then the second objective, the critical objective, really is to implement these approaches, which are participatory video and community dialogue approach, and then to evaluate them in a number of ways.
You emphasized on the community engagement approach to tackle the drivers of antimicrobial resistance. Would you please elaborate the usefulness of community engagement approach, which is embedded in the COSTAR project, in relation to its possible benefits to Nepal?
My understanding from talking to colleagues who are very engaged with the Nepali policy context and health system context is that at the moment there is not a very strong emphasis on utilising community engagement approaches as part of a package of interventions to address AMR. So of course there are many ways in which we can address this critical issue. For example, strong policy, support to providers to enable them to have better prescription practice, etc., surveillance and the uptake of vaccinations, etc. Another element within that package is community engagement, whereby you drive and you create demand for good quality services around antimicrobial prescribing, but you also produce more awareness within the population about the appropriate use of antimicrobials, both in humans and animals. There are lots and lots of issues that community engagement can unpack. And specifically, what can it mean for a country like Nepal? Well, I think this is AMR, antimicrobial resistance, is a global problem. So wherever we act, whether we act in the UK or other parts of Europe or sub-Saharan Africa or across South Asia, including Nepal, we are collectively contributing to addressing the challenge of AMR. So when we act within Nepal, it's good for Nepal and for Nepali people, but it's also good for the wider region and for the world. So it's a very important area of global collective action.
So, what roles do you think community can play to address the drivers of AMR?
So when we learn about antimicrobial resistance, it's a question of thinking, what can I do personally to address the challenge of AMR? It's about thinking and understanding that antimicrobials, antibiotics and other types of antimicrobials are really critically important medicines, and they do save lives. They often save lives. So we must use them when we need them. It's very, very important, but we must use them well. And we can be helped to use them well when we visit health providers who can help us to understand which medicine we need for which disease and how we should take them. And also thinking in the same way for our animals, for our pets, for our livestock, etc. And then also understanding a little bit about how we can ensure that we're preventing infection and taking action as individuals and collectively to prevent infection. Because when we prevent infection, then we have less need to use antimicrobials, and therefore we are already addressing the drivers of antimicrobial resistance. And many of us know many of the ways in which we can prevent infection. So that will be things such as washing our hands at the right times and eating kind of well-prepared and clean food and having our vaccinations, etc. But there are other ways that are important as well, which include ensuring that we keep our animals clean and well fed, and we have good separation between animals and humans in ways that are explained and encouraged by those veterinary experts who can guide us on such matters. So I guess my general message is that we can all take simple steps to address this global challenge of antimicrobial resistance, and it would be wonderful if we are able to do so. Thank you.
Today we talked about antimicrobial resistance and COSTAR project. Our guest for the talk was Dr. Rebecca King, Principal Investigator of COSTAR project and Head of the Nuffield Centre for International Health and Development, based in the University of Leeds in UK. Thank you for watching us.